Welcome to Mythos AI, your source for Cliff's Notes on complex subjects. Join Anna and Phil for yet another engaging conversation.
Today, we're going to be taking a deep dive into the life and career of Robert F. Kennedy Jr.
Really focusing on his recent nomination as Secretary of Health and Human Services.
Yeah, and our main source for this deep dive is a document called Who is Robert S. Kennedy Jr.? An analysis of a controversial political figure and his potential role as Secretary of Health and Human Services.
It's a nomination that's really caused a lot of discussion, hasn't it? And it's really kind of raised some serious questions about where public health policy in the U.S. is headed.
Yeah, for sure. I mean, to even begin to untangle this whole thing, I think we've got to first understand, like, who Kennedy even is. You know, I mean, the guy comes from, like, the Kennedy family. This family is basically American political royalty. I mean, they are known for, like, their commitment to public service.
Absolutely. And I mean, his father, Robert F. Kennedy, was, U.S. Attorney General.
Right, and was assassinated, like,
Yeah.
right in the middle of his presidential campaign in '68.
Exactly. So, growing up in that kind of environment, that politically charged atmosphere, it must have had a huge impact on Kennedy Jr.'s worldview. The document we're looking at even points out how he often brings up his family's legacy, especially their work on civil rights and social justice, to kind of bolster his own activism.
Yeah, totally. And, early in his career, Kennedy Jr.'s focus was on, like, a different kind of justice.
Environmental justice.
Right, exactly.
Yeah.
He was really, like, all about protecting natural resources, especially water.
And he was incredibly successful, too. As a, chief prosecuting attorney for the Hudson River Keeper and then a senior attorney for the Natural Resources Defense Council, he really spearheaded efforts to reduce pollution and protect waterways. He also co-founded the Waterkeeper Alliance.
Which is, like, a global organization, right? Dedicated to protecting water resources.
Exactly. I mean, all this really solidified his reputation as, like, a true environmental advocate.
Okay, but then things shifted, right? Like, in 2023, he announced he was running for president in 2024.
Yeah. At first, he was going for the Democratic nomination. His whole campaign was centered around things like government transparency, holding corporations accountable, and kind of pushing back against what he saw as, like, too much influence from pharmaceutical companies.
But then there was the whole vaccine thing.
Yeah. His stance on vaccines created a lot of tension between him and the Democratic Party.
Which we'll get into more later.
Definitely. But yeah, all this tension led him to run as an independent candidate under the We the People Party.
And that was kind of a rough road.
It was. He ended up suspending his campaign and endorsing Donald Trump.
Which, I mean, shocked a lot of people.
Absolutely. And many believe that endorsement was a big factor in his nomination for Secretary of Health and Human Services.
A nomination that has definitely caused a lot of controversy.
For sure. To really understand why there's been such a strong reaction, we need to look at the controversies that have surrounded Kennedy Jr. throughout his career.
And I think the biggest one has got to be his stance on vaccines.
Yeah. Kennedy has been very vocal in his criticism of vaccines. He's alleged a link between vaccines and autism, among other health problems.
Right, and it's important to point out that those claims have been widely debunked by the scientific community.
Absolutely. The consensus among medical and scientific professionals is that vaccines are safe, effective, and absolutely essential for public health.
So, because of his anti-vaccine views, a lot of public health experts have actually accused him of spreading misinformation.
Yeah, and even, endangering public safety. They're worried that his views could undermine years of progress in preventing infectious diseases.
And that concern is even bigger now that he's been nominated to lead the Department of Health and Human Services.
The agency that's literally responsible for overseeing all of the nation's health policies and programs.
Exactly. I mean, public health officials are worried that if he's in charge, less people will get vaccinated.
And that could lead to a resurgence of preventable diseases. It's a serious concern.
And the skepticism about his nomination, it goes beyond just vaccines. Like, there's been a whole string of incidents that have made people question his judgment.
And whether he's really fit for such a high-profile position.
Yeah, like, what about that McDonald's incident?
Oh, right. Back in August of 2024, Kennedy was actually photographed eating McDonald's on Donald Trump's private plane, no less.
The irony.
Yeah, well, he'd been pretty vocal in the past about criticizing fast food, calling it poison even.
So, of course, people called him a hypocrite.
Saying it showed a real disconnect between what he says and what he does.
And then there's the fact that even his own family doesn't seem to be on board with his views.
Right. His cousin, Caroline Kennedy, who's the U.S. ambassador to Australia, publicly criticized his stance on vaccines. Called it dangerous, in fact.
And her statement really highlighted how the Kennedy family has historically been very supportive of public health initiatives.
It really kind of distanced the family from Kennedy Jr.'s controversial views.
Yeah. And then in July of 2024, Vanity Fair published this article detailing sexual misconduct allegations against Kennedy.
From Eliza Cooney, who used to be a babysitter for the family.
And the alleged incident, it supposedly happened in the late 1990s.
Kennedy has said he had a rambunctious youth, but he hasn't directly addressed the allegations.
And that's just added another layer of controversy to an already complicated public image.
Yeah, and it's raised even more questions about his character and if he's really the right person for public office.
And then there's that kind of bizarre story about Kennedy and, well, a dead bear.
Oh yeah, back in 2014, Kennedy admitted that he left a dead bear in Central Park.
Okay, what?
Yeah, he claimed he found the bear after a car accident and thought about preserving it, but then he just ended up leaving the carcass in the park.
This guy.
Yeah, well, the whole thing resurfaced when he was nominated, and it didn't exactly help his image. People thought it was ridiculous, and it just made them question his judgment even more.
And then there's the whole brainworm thing.
Right, so in 2012, during a deposition, Kennedy revealed that he'd had a parasitic brain infection.
Wait, what?
Yeah, he said a worm got into his brain, ate part of it, and then died. It sounds crazy, but it can happen. It's probably from a pork tapeworm, and it caused some pretty serious memory loss and cognitive problems for Kennedy. He's recovered since then, but still.
Wild. And yeah, I can see why people would be concerned about his health and if he can handle being Secretary of Health and Human Services. But let's move on from the controversies for now.
Okay.
What would Kennedy's vision for the Department of Health and Human Services even look like if he is confirmed?
Well, a lot of it comes from his background as an environmental activist and his, distrust of the pharmaceutical industry.
Right.
He's really focused on addressing what he calls the chronic disease epidemic in the U.S., and he thinks environmental factors are a huge part of that.
He's talking about things like pollution, exposure to chemicals, all the pesticides we use.
Exactly. So he wants to put stricter regulations on industrial emissions, agricultural practices, that kind of thing. The goal is to, improve public health outcomes.
And that focus on environmental health ties into his whole thing about a holistic approach to healthcare.
Right. So he's really big on preventive measures, things like eating better, getting more exercise, managing stress. He thinks that's the key to improving overall health and reducing our dependence on pharmaceuticals.
Interesting. Now, Kennedy has also been really critical of how much influence the pharmaceutical industry has on public health policy.
Oh, yeah. He's been very vocal about that. He thinks they have way too much power, and he's all about more oversight and transparency when it comes to drug pricing.
It's funny, though, because despite his whole thing about vaccines, he still calls himself pro-vaccine safety.
Right. He wants more rigorous and independent testing of vaccines. But critics say his rhetoric often sounds a lot like anti-vaccine conspiracy theories.
Yeah, it can be hard to tell where legitimate safety concerns end and, unfounded claims begin.
For sure. Now, another big part of his vision is government transparency, particularly within agencies that deal with health and environmental safety.
Gotcha.
He's in favor of setting up independent health advisory panels, and he wants states to have more autonomy in how they manage public health initiatives.
So less federal control.
Exactly. He also wants to lower healthcare costs, through things like expanding insurance coverage to include alternative medicine, cracking down on fraud and waste within the healthcare system.
Makes sense. And with the opioid crisis still raging and the, mental health crisis in this country, I'm assuming he wants to expand access to mental health services.
Oh, absolutely. And he's planning to hold pharmaceutical companies accountable for, their role in the whole substance abuse problem.
Food systems reform is another thing he's focusing on, right?
Yeah, he's promoting regenerative agriculture and wants to see comprehensive nutrition education programs. The idea is to improve the quality of the food we eat, which should lead to better public health outcomes.
Seems like a pretty ambitious agenda. So what's the public's take on all of this?
Well, it's been a mixed bag, to say the least. Some people really love the guy.
They see him as a reformer, someone who's going to shake things up.
Exactly. They think his skepticism of big pharma and his focus on environmental health are just what the Department of Health and Human Services needs. They see him as someone who will challenge the status quo and fight for the average person.
Okay, but not everyone's convinced.
Definitely not. His critics, a lot of them anyway, are really worried. And we're talking about public health experts, politicians, even members of his own family.
Yeah, the vaccine thing is a big sticking point.
Huge. They're afraid that if he's in charge, people will start to lose trust in scientific institutions and the guidance they provide, and that could have really negative consequences for public health.
I can definitely see that. So what about the confirmation process? It's going to be a battle, right?
Oh yeah, you can bet on that. His views on, well, pretty much everything are going to draw some serious opposition from both sides of the aisle. The whole situation is really complex. Kennedy's background, his activism, all the controversies, it's caused a lot of both praise and condemnation.
It really shows how divided American politics are.
For sure. And it highlights how hard it is to figure out public health policy in a time when misinformation and distrust are everywhere.
Yeah, it really is a mess.
It is.
And, on one side, you've got Kennedy's supporters who see him as this, champion of the people.
This fighter going up against corporate greed and government overreach.
Exactly. And then on the other side, you got his critics, and they're worried about, well, what his leadership will actually mean, especially with his stance on vaccines and how that could affect public health.
It's hard to say for sure whether Kennedy's time at HHS, if he even gets confirmed, would actually lead to positive changes and reforms.
Or if it'll just make things even more divided.
Well, either way, this nomination has definitely sparked a really important conversation about the future of healthcare in America.
A conversation we all need to be a part of.
Absolutely.
So this deep dive, we really wanted to give you the information you need to understand just how complex this whole nomination is.
And to help you sort through the different perspectives out there.
We encourage you to keep learning about this, think about the different viewpoints, and really try to come to your own conclusions about what Kennedy's potential leadership could mean for the health and well-being of this country.
It's a complicated issue, but it's one that affects all of us.
That's all the time we have for this week's Deep Dive.
But this is definitely a story worth following as it develops.
Until next time.
Thanks for listening to Mythos AI. Stay tuned for more concise insights. And remember to hit the like button and subscribe for future episodes.